Hello, everyone. Greetings from the States, from Moline, Illinois. That's where I live. I hope you all are doing well and still enjoying your CPE classes and all of the experience. You certainly have a lot of work to do as I read about your assignments, and I admire and respect you as you go through this process. So thank you for being a student of CPE. And tonight we're talking about a rather difficult subject, and that is understanding suicide better so that we can help people if we have the opportunity to help prevent suicide. So we're going to be talking about that and also ways to help you as a caregiver, a chaplain, a counselor, just some brief tips on how to do that. So, anyway, as we get started, you may know someone who has attempted suicide but was not successful. You may know someone who did die from suicide, whether that be family, friend, coworker. Um, so I just want you to know that it can bring up feelings within yourself as I talk about this. I know it did for me personally. My father died at 51, and it was in a car accident. The car went off the road and hit a tree. But to this day, he died in 1985. And to this day, I still wonder if it was not suicide. And as I studied for tonight, it brought back a lot of feelings and doubts. And as I read the signs that I will share with you, it was very scary, actually, to think he had a lot of those. So, suicide has been on the increase here in the States and around the world. And this article and Pastor Chaplain Nato can give you this link that I am using called Help Guide, Suicide Prevention Help Guide.org. But the World Health Organization estimates that approximately 1 million people die each year from suicide. And as you know, during COVID 2020 and 21 especially, even healthcare workers committed suicide from depression and hopelessness and burnout and seeing people die. Committed suicide. And we have a large percentage of our military, armed forces people, veterans that come back and have PTSD and just are so depressed and hopeless and despairing that they commit suicide. That has been on the rise a lot. So I don't know what situations there in your culture, where you live, the province you live in, what you might think causes more suicide. But maybe after tonight, some things might become clear to you. But A suicidal person is in so much pain and despair that they can no longer see any other way, no other options but to end their life. And that's very sad for those that are left behind, family and friends. It's sad for us to even hear that, that surely someone can get help. Surely someone doesn't have to kill themselves, to end a deep depression. But it is a desperate attempt to escape hard suffering that has become unbearable to live and to carry on. So just keep that in mind, from this moment forward, that we cannot, no matter what kind of feelings we individually have about suicide, whether that be religious, spiritual feelings, or any other stigma that might go along with a person who commits suicide, it is a mentally, emotionally, physically, a desperate situation that has become unbearable. Um, a lot of times, people who commit suicide are blinded by feelings of self-loathing. They hate themselves. They feel hopeless and very much in isolation and alone. So they can't see any way of finding relief except through death. But I think that despite a person's desire for the pain, emotional, mental pain, to stop, most suicidal people, before they actually kill themselves, are very much conflicted about ending their own life. And they wish or hope or dream or pray for another alternative to suicide. Okay, so I want to start with some misconceptions about suicide from this article. Myth number one: people who talk about suicide won't really do it. And the fact is that most people that even attempt or are successful at suicide give some little clue or warning. So don't ignore any indirect references, even to death or suicide. Some statements that people might use are, you'll be sorry when I'm gone. I can't see any way out. No matter how casually that seems or jokingly said, may indicate some serious suicidal feelings. So people that even hint or talk about it in a joking way can really have some suicidal feelings. And so we can't ignore that. Myth number two: anyone who tries to kill themselves must be crazy or mentally ill. The fact is that most suicide people are actually not clinically psychotic or insane. They are upset, they are grief stricken, they are depressed or despairing, but extreme distress and emotional pain don't always indicate mental illness. So we know that depression is mental illness, but sometimes the emotional hurt and pain or distress is not been there for a long time, or it could have been there from a long time from some mental health, which we will talk about. But it doesn't mean that these people are mentally ill or have a mental illness. The third myth: if someone is determined to kill themselves, nothing is going to stop them. Well, that's not necessarily true, because even a very severely depressed person has mixed feelings about death, fluctuating between wanting to live and wanting to die. Some people might even be afraid of life after death, and they know when they do die from suicide that there will be something after death. And so they just want the pain to stop. Sometimes physical pain, but mental and emotional pain to stop. So, myth number 4: people who die by suicide are people who are unwilling to seek help. The fact is that many people try to get help before attempting suicide. In fact, studies indicate that more than 50% of suicide victims had sought some kind of medical help in the 6 months prior to their deaths. And that could be a lot of different ways that they sought help. But just know that most people, 50% at least, try to get some form of help, even if that is talking to a friend or going to a doctor, whatever they might try to do. And myth number 5 is talking about suicide may give someone the idea. So we shouldn't talk about it, right, in front of that person. But the fact is you don't give someone suicidal ideas by talking about it or bringing it up. Rather, the opposite is true. Talking openly and honestly about suicidal thoughts and feelings may help save a life. So those are some of the misconceptions about suicide. There were 5 of them. And then warning signs of suicide. Okay, take the suicidal talk or behavior, either verbal talk or behavior, seriously every single time. Because it's not just a warning sign that a person is thinking about suicide. It is a cry for help. So we need to always remember that and always take it serious. Most suicidal individuals give warning signs or at least some kind of signal of their intention or their plan. The best way to prevent suicide is to be able to recognize those warning signs and know how to respond to them. So if you believe that a family member or friend or coworker is suicidal, you can play a role in suicide prevention by even just listening and then talking about alternatives, showing that you care, and helping them get to a doctor or a psychologist. Major warning signs for suicide include talking about killing or harming oneself, talking or writing a lot about death or dying, seeking out things that could be used in a suicide attempt, the method, such as weapons or drugs. All of these signals are even more dangerous if a person has a mood disorder, such as depression, bipolar, suffers from alcohol dependence, has previously attempted suicide. That one is very, very important. Some patients I run into in the hospital have attempted suicide 2 or 3 times, and maybe the time that I see them in the hospital is the third or fourth time in their history. So that's an important one as uh, a dangerous sign. And finally, has a family history of suicide. So, and then a more subtle, not so obvious, but equally dangerous warning sign is always hopelessness. A person that wants to commit suicide is totally, totally hopeless. They feel that hopelessness. Studies have found that hopelessness leads to people feeling unbearable feelings. They just can't live every day with those feelings, or that predicts a very bleak future, or state that they have nothing to look forward to. So if you are around people or patients that talk this way, um, then that is a key or a sign that you need to step in and help them do something about that. Other warning signs that point to a suicidal mind frame include dramatic mood swings or sudden personality changes, such as someone that might be real outgoing and then they totally withdraw, or from a well behaved child or teenager or person to someone who just becomes very rebellious, but in an extreme different way, where they almost seem like a different person. Um, a suicidal person may just lose interest in the everyday activities. They might neglect their appearance or show big changes in their eating or sleeping habits. And a lot of these things we've talked about with all of the mental health things that we've gone over before in the past. So that was sort of a brief summary of some of the warning signs of suicide. And I want to go a little bit further and elaborate on those some more, and give you some maybe verbal examples. Talking about suicide or dying or self harm, such as if you hear the phrase, I wish I hadn't been born, or I'll see you again. Everything's going to be all right. I'll see you again. Or more explicit or direct, I'd be better off dead. So those are some expressions um, that people often say when they're suicidal. And in your culture, I'm not sure how people would express those feelings or intentions, but that might be something good to talk about in your groups. What are with each other as peers? What are some of the ways people talk there in your culture? Another suicide warning is when you're around a person that not only talks about it, but you know that they are seeking out lethal means of killing themselves, such as they're trying to get guns or pills or drugs or knives or other objects that can be used as a suicide attempt. So, just be aware, because that is definitely, if you're around somebody and not say in the hospital, but outside of your hospital ministry, then that they are looking for a means to plan this suicide. Let's see. Now, another one is if someone is always preoccupied with death, they're just focused on death or violence, or, it's even common that people will journal or write in a diary or write poems or stories about death. Some people might draw pictures in their journal or notebook. And if you see any of those or you hear people just with this preoccupation with death, then that is a clear warning sign. Someone that expresses their feelings of helplessness or hopelessness by saying or indicating that there's no hope for the future. It's just all over. Um, and that usually comes from feelings of worthlessness, guilt, deep shame, even self hatred, where, just they're feeling like a burden to everybody, and everybody would be better off without me. So no hope for the future, and then this self-loathing or self-hatred. If you see or notice that at all, and it, you know don't think, oh, it's just in this moment, but check it out. And then someone that is getting their affairs in order. And it doesn't have to be an older person, it can be a younger person. But, and I don't know if Filipinos really have or make out a will or like have power of attorney for health care or power of attorney. But when a person starts saying things like making arrangements for their family members, or saying things, I want you to have this when I'm gone, or making out a will when there's no terminal illness or no reasonable way that they should be talking about it and doing it. So that's one sign, could possibly be a sign, if especially with it, if it is with all these other signs. Saying goodbye, like with unusual or unexpected visits or calls to family and friends. There's a way that people can say goodbye in a subtle way that can express, like, I won't see you again. I won't be seeing you again. I'm saying a final goodbye. And in fact, my dad did that. I was working on a church staff in Richmond, Virginia, and he had been withdrawn, and people hadn't heard from him. And he called me at the church office where I was working, and I got out of staff meeting, and that was the last time I talked to him, because that Sunday he died on the road traveling, and I talked to him on Tuesday morning. But there was this finality to that phone call, and so you will know the difference when someone is trying to say a goodbye, because they know they have a plan to execute. They have full intention. They have everything in order. I've already mentioned withdrawing from others, especially family, friends, increasing social isolation, just become a loner. And then any kind of self-destructive behavior, which could be increased drugs or alcohol, a reckless driving, you know, um, cutting on yourself. So anything that appears as self-destructive behavior. And then usually in the stories that I've heard, there is this unusual calm, sense of calm, and everything's okay, almost happy after being extremely depressed. Could mean that a person has made a decision to attempt suicide, and that they're calm and they're more up and happy after a long, deep depression, because they know it's about to end. So those are things, I'll go over those again. A sudden sense of calm, self-destructive behavior, withdrawing from others, saying an unusual goodbye, getting affairs in order, self-hatred, no hope for the future, preoccupation with death, and talking about suicide, and seeking out lethal means to commit suicide. So from here, I would like to talk about, in this article, there were some suicide prevention tips. And tip number 1 is speak up if you are worried about someone. So if you spot the warning signs of suicide in someone you care about, you may wonder, I don't think I should say anything, because what if I'm wrong? What if they really aren't thinking about suicide? Or maybe it'll make them want to commit suicide. Or what if the person gets angry at me because I brought that up? It is natural for us as a person who sees it in someone else to kind of feel uncomfortable or afraid about that. But anyone who talks about suicide or shows other warning signs needs immediate help. The sooner, the better. Can't say that enough. The sooner, the better. So talking to a friend or family member about their suicidal thoughts and feelings can be extremely difficult, not only for the person who's thinking about suicide, but for the person who is listening. But if you are talking with someone, listening to someone, and you're not sure if they haven't come out and said, most of them don't. Most people don't say, okay, this is my plan. I'm going to commit suicide on this day by this means. But if they are showing all of these other signs I've mentioned, and they're talking and expressing feelings of hopelessness and despair, the best thing to do is to be brave and courageous and say, and ask them, are you thinking about suicide? Do you have feelings of wanting to die? To just directly come out and ask that question. Now, I know your culture is more of a non-direct culture, but as a professional person that you are working in counseling or chaplaincy or even pastoring, in those roles of professional helping vocations, you almost have an ethical responsibility to do this, and to be direct when you think that it could be serious, especially. And so you show that you care when you have sat with someone, you've listened to them, and you just think, I must ask this, you know, are you feeling suicidal? Have you thought about it? And then just let whatever happens, whatever they say, whatever comes out, even if you sit with them in silence for a few minutes. So never hesitate to ask as a professional person. So a little tip about ways to start a conversation about suicide. Something like, I've been feeling concerned about you lately. That is a good opener. Or recently I've noticed some differences in you, in your moods and behavior, and wondered, how are you doing? How are you doing? And then another good way to start the conversation about suicide is, I wanted to check in with you because you haven't seemed yourself lately. I'm just checking in. How are you doing? You haven't seemed yourself lately. And those are open-ended questions, but they also express care and concern. So, and if they begin to open up a little bit, you could then ask them more questions like, when did you begin feeling like this? Did something happen to make you start feeling this way? And how can I best help you or support you right now? And then, have you thought about getting professional help, doctor or counselor, psychologist? So, and then offering, as we do in counseling or chaplaincy work, offering supportive, affirming, encouraging, hopeful comments, things that you can say that can help. Like, say you're in conversation and you do ask the person if they're suicidal or if they have feelings of wanting to harm themselves, and they let you know that, yes, I have. And then you ask some questions like I've just mentioned, you know, when did you begin feeling this way, or how long have you been? That's important to know that. And did something happen that made you, you know, come to this, made you feel this way? Then you can say, you're not alone in this because I'm here with you. Or you may not believe it now, but your feelings can change. They will change. So offering that reassurance. And then, I may not be able to understand, you can say, as a person trying to encourage them, I may not be able to understand exactly how you feel, but I care about you and I want to help. And then another statement, when you want to give up, tell yourself you will hold off by just one more day. You will hold off wanting to kill yourself by just one more day, one more hour, one more minute, whatever you can manage. Just hold off. Don't do it now. Don't do it right now. Just hold off for a minute, an hour. And in that hour, maybe a help will come and they will not do it. And so you're trying to encourage them, wait, give some time. You know, help will come. You won't always feel like this in this moment. So, so those are some things that you can open a conversation with, that you can say to them to support and care and encourage them, but also about yourself when you're in that helping role. Um, be yourself, and you don't have to be afraid of saying the right things or even acting in your professional role. Just be yourself in your compassion and in your caring to that person. Um, just be yourself. And then listen when someone is unloading or venting. If a suicidal person will do that, um, no matter how negative the conversation seems. Um, the fact is that as you are listening reflectively, attentively, something positive is happening. So be yourself, listen well, and be sympathetic, empathetic, and non judgmental. No matter how difficult it may be to hear some of the things that they are sharing, but you're there to care, not to judge, and to offer hope. Reassure your loved one, family members, those are hard, that help is available and that the suicidal feelings are just temporary. So let the person know that they are important to you, the one that is there for them. They are important to you. And finally, take the person seriously all the time in the moment. Don't let yourself doubt whether this person might try to attempt suicide. Act as if they are every single time. So, and just if you're comfortable and you're relaxed and you're not judging or trying to worry about how you can help, but you just are taking the person serious and you're caring in the moment. So now I'm going to give you some tips about what you don't want to do. Don't do these things. Argue with the suicidal person. What I mean by arguing is like saying to that person who's deeply depressed and in despair, in a black hole, by saying, you have so much to live for. Your suicide will hurt your family, or that's being selfish. Just snap out of it. That is not helpful. It's not good. So try to refrain from saying that. And we call that, debating or arguing with the suicidal person. Don't act shocked or scared if you can help it. If you're calm and you're not shocked that this person is thinking this way and going to act on it, or you are not arguing with this person, but you are rather speaking for hope and the value of life. So, and then the third thing is promise confidentiality. Um, the only time that you wouldn't promise confidentiality in situations like this means you don't go off and tell family, friends, workers, co-workers, all that. But if you sense that a person is about to do something like that in order to keep the suicidal person safe, you may need to speak to a mental health professional. But And I have told people that before. I've said it's as a pastor or as a chaplain, even if it's outside the hospital, I say it's my ethical and spiritual responsibility to report this to a mental health profession or a crisis hotline because I want to help you not do this. I want to keep you safe. And if you promise to this person that you're not going to tell anybody else, but only a mental health professional, then you are letting them know, you're trying to help keep them safe. Um, and then offer ways to don't offer ways to fix your loved ones, especially families, problems, or give advice or make them feel like they have to justify their suicidal feelings. It is not about how bad the problem is, but how badly it's hurting your friend or your loved one. And so we can't fix their problem, even though we want to. And sometimes helping turns into trying to fix. There's a fine line there sometimes. Helping professions uh, have a tendency to want to fix, but um, you're there in a supportive way and not to try to fix it. And there's no way a person is going to choose suicide, and there's no way we can keep them if they're determined, except for try to keep them safe. But just remember that. And last, don't blame yourself if you can't fix someone else's depression. I've I'm still learning that. All my life, I've been a fixer and I've wanted to um, fix people and relationships. And you cannot fix someone else's depression. Um, you can be supportive. You can, when they ask you for resources, you can give that, but we can't change people. They have to want to change themselves and get the help, resources that they need. Um, so tip one, let me just go back and say tip one was speak up if you are worried. Tip two is respond quickly in a serious crisis situation. So no, that's what we just covered. Um, so that's what we just covered by what you can say, and when talking to a suicidal person, what to do and what not to do. Okay, so and then if a friend or family member tells you that they're thinking about death or suicide, it's important to evaluate the immediate danger the person is in. So you're doing like an assessment or an evaluation. And those at the highest risk for committing suicide in the near future, they have four things. They have a plan already in mind. They've mapped it out mentally, a means to carry out the plan, how they will do it, a time set when they will do it, and they have a will or intention to carry it out completely successfully. So those four things will be there. And so this is responding in a crisis quickly. This is tip number two. I was lost for a few minutes. Now I'm back on track. And you can even ask to help assess the severity of this situation, or the seriousness. Is it really an emergency? Is it a crisis? So ask, do you have a suicide plan? Um, do you have what you need to carry it out? Do you know when you would do it? And so then after that first kind of level of assessment, you go to the next step, and you're really putting it into a category of the level of risk. A low level is you determine that there is some suicidal thought but no plan, and the person says to you, the caregiver, in the role of helping, they won't commit suicide. They say back to you, okay, I'm not going to commit suicide. That is a low risk. And I've indeed talked to people that have said, you know, this is, I have some thoughts every once in a while about suicide, and but I don't really carry it to the degree that I create a plan. And I'll promise you I will not. And then the next level is moderate, where a person has suicidal thoughts, not just every once in a while or infrequent, but they have them. And there is a vague plan that's not very lethal. Like maybe what I mean by that is take enough pills to make you um, sleep deeply and hard to wake up, but not enough to make your heart stop and stop breathing. So, whereas a gun to kill yourself or hanging is more lethal. And they say they won't attempt suicide. That's moderate. But then you go from moderate to high, and the last is severe risk of suicide risk. And high is there are suicidal thoughts, this a specific plan. You know that they've told you, I have a specific plan, and it is lethal, and they still say they won't attempt suicide. So the first three, low, moderate, and high, say they won't attempt suicide. Once you get all of this out in the open, then you're at this level of trying to assess the risk. The last one is severe. There's suicidal thoughts. The specific plan is in place that is lethal, and the person says they will attempt suicide. That is a emergency, high level of crisis. So if a suicide attempt seems imminent, close, about to happen, call a local crisis center, or any kind of emergency center, or if you can, take the person to an emergency room and remove all weapons or ways that could harm a person. Remove it out of their reach. And never, never, never leave a suicidal person alone. So that is, respond quickly in a crisis. Tip number 3 is to offer help and support, by offering an empathetic, caring heart, listening ear, especially when you're talking to family. We have a lot of young adults and teenagers in our area that have taken their life, and devastating for the family. But you let them know that they're not alone, especially if it's your own family member, and that you care, and you are there to help offer support in any way, um, but that they need to have a will to want to get help and do it as soon as possible. Um, Witnessing a loved one dealing with thoughts about ending their own life can stir up many difficult emotions. And as you're helping a suicidal person take care of yourself, find someone that you can trust to talk about your feelings, and what it was like for you to help someone that was very close to suicide, especially in that crisis situation. Um, so, you know, the ways we can help is to get that person to a professional mental health provider or an emergency room, a crisis line, and then follow up with your care and concern. And most people that try to commit suicide will definitely, if they're not already on a antidepressant, that medication will be given, and other meds if needed, but they will take that person where they're at, the hospital, the medical facility, and the mental health, and they will get a plan going. But never, that person shouldn't be alone until they get better. And a lot of times, people that want to commit suicide feel like they believe they cannot be helped. Um, they at first especially, but then when people are caring and they're around them, they want to help, then they can begin to believe, well, maybe there is a way out, maybe I can be helped. So um, so we as friends or family don't want to say, just call me if you need me, but don't wait for the person to call or return your call. Be proactive and drop by, try calling again, invite the person out, just walk side by side with them. And that goes a long, long ways. um, Encourage positive lifestyle changes, make a safety plan, and that safety plan could be things like helping a family or friend identify triggers, and that could lead to suicidal crisis, such as alcohol, the death of someone in the family or close to them, stress from relationships. But identify triggers, and then also put contact numbers when a person might really need to call someone right then to reach out to. Um, a therapist, a doctor's number, friends, family that can help in an emergency, and remove, as I've said, any potential means of suicide. And and then continue your support. So just also know that risk factors can be things like abuse, when a person had a lot of abuse in their life, earlier life, depression with distorted thinking, schizophrenia, bipolar, um, and terminal illness, previous suicide attempts, mental illness. So those are things that can increase the risk, that are factors. And but just be aware of that, and you can start making your own resource book. These things that I have been talking about actually are from this website, and it is Suicide Prevention Help Guide and you could make up your own little booklet of these, printing them out, and then you could have your own guidelines to go by and to go back and study or remember. So I hope this is helpful, and it's long, I think, so it might be divided into two sessions if Chaplain Nato decides to do that. But I hope that you haven't experienced someone close to you that committed suicide. But if you do, the hard part of grief is knowing that it was not our fault. And there, we always think maybe I could have prevented it, but it's not that. It's that person's will, and there was not help before the attempt, which was successful on a person who died from suicide. So I hope this isn't been too painful of a topic, but something that could be helpful. And I look forward to reading your reflections. Okay, take care of yourself and each other, and God bless you. Good night.